All right, so we're going to be testing for what is our scenario?
For A.
Patient A.
Well, what are we testing? It's going to be Lyme's disease. So from Lyme's disease, that's vector borne. So what does vector mean?
What is vector?
What's a vector?
It's something that carries the virus.
Yeah, so it's going to be like mosquito, tick, or whatever. It's going to be a
Yes.
vector. Nice. So we're going to be testing for that. So what's your scenario for patient A?
Western blot.
She went on a hiking trip.
Felt feverish and achy.
Feverish, aching. So Lyme's disease, we'll look for a bullseye rash, fever, malaise, things like that. So when you're reading through all of these case scenarios, if these were patients, we'd say, well, from what they're telling us, they have malaise, they have a rash, they were hiking, they were camping. One of them said their friend had it. So there's all possibilities where the person might have it. So I'm going to take the antigen for Lyme's disease, I'm going to put it in all of the wells. Okay. Then I'm going to take what's here, it says positive control. So I know that this is going to have the antibody in it. All right, so it should be antigens in here. This will have the antibody in here. We're going to do 3 wells for each scenario just to triple check. Was it 1 or 2? You know, you might have a false positive. So we're going to do 3 for each. Then I have something called the negative control. So I know this shouldn't have a positive reaction. All right. Then I'm going to take the primary antigen and put it all in that. I'm going to do a secondary antigen. So does anybody remember from lecture what the secondary one's going to do? So I have the antigen. I have the antibody. All right. Antigen-antibody complex. Then I have to add the secondary antigen to it. It's going to attach to the antigen-antibody complex, which is big. That's going to have an enzyme on it. And then I'm going to add the chromogen to it.
Change color.
Chrome means color. It's going to change color. Initially, it's going to be light green. If the patient has a positive response, it's going to turn purple. All right. But what if it turns dark purple? We know the antigen-antibody reaction is strong. What if it's a very light purple?
Not as strong.
Not as strong. So what are some scenarios if it's not as strong?
A newer infection.
A newer infection. So maybe you didn't have a full chance to get the titers up, all right? Or maybe that's an older infection. All right, so just realize if they have a positive response, depending on the color, it might be a weak response or a positive response. So when we're all done, some of the wells should be dark purple. I know it's antigen-antibody reaction. I know that patient literally has Lyme's disease. If it's light purple, they may have Lyme's disease. It might be early infection or it might be a late infection. We'll see what the scenario is. All right, so what I'm going to do is I'm going to take a pipette, and what does your first line say? I'm going to put the primary antigen, 3 drops. Everyone can read?
Yep.
I don't have my glasses. All right.
Oh, I don't like that noise.
Yeah, that was annoying.
All right, so I'm going to do... All right, so I'm going to put the antigen in each one of the wells, 3 drops. All right, in real life, we would rinse these between each. So if something didn't bind to the antigen, we'd flush it out. But for this lab, it doesn't really, it's a simulation. And we're doing, we're not doing direct, we're doing indirect. Pipettes are terrible.
Oh, see, they're so tiny.
Yeah. Should have got a bigger one, but. Well, it's going to be all right for the other ones because we don't want to cross-contaminate. So I'm going to use a separate pipette for each one of the patients, so we don't cross-contaminate. All right. What does step 2 say?
3 drops of positive control.
Positive control in the first 3. So that's going to be A1, 2, 3.
With a fresh pipette.
the fresh pipette. So my positive control is going to be actually we know this is actually the antibody here. All right, so I'm going to do 1, 2, 3. So I'm putting the antibody into the well, but it's not going to show up until I put the secondary antibody attached to it and then the chromogen to it. So the next one should be negative control, correct?
4, 5, and 6.
4, 5, and 6. 3 drops?
Yep.
All right. Can't screw this up now. So negative control, it's not the antibody or the antigen. All right, so the next one is going to be
3 drops of patient A, 12, 7, 8, and 9.
so patient A, and I'm going to do 3 for each. Why am I doing 3?
To triple check.
Triple check. All right. Why am I asking these questions out loud?
This is going to be on the practical.
See how smart you are? All right, patient B goes into 10, 11, 12. Yeah, see how careful I am. All right, so this should be B1, 2, 3. So this is B4, 5, 6. So should be 7, 8, 9. So I don't know which one of these patients so theoretically this would be their blood plasma we're putting in here to see if they have the titers for whatever it happens to be. All right, so what did I put in each well initially?
So, yeah, 3 drops of
Antigen. Okay. So I put all the patient serum in there. Now I should be doing a secondary. Okay, why am I doing the secondary one again?
So it can bind.
Yeah, so it's combined because we have, if the patient has the antibody, it's attaching to the antigen. All right. Now, if they're positive for it, there's an antigen antibody reaction in the well. All right, but it's not big enough. All right. Or the chromogen, the color won't attach to it. So I have to do a secondary antibody to all of these. What's it saying?
3 drops
To every single well?
to each well of rows A and B.
Yes.
Don't let it touch the liquid that's in
All right, so I'm doing the secondary to attach to the antigen antibody reaction. So I have antigen in all of them. I have positive control, negative control. Right, I have patient's serum in each one, and then I just added the secondary antibody to attach to antigen-antibody complex if it's present. Right, so it has to be present for one or two of these patients are going to have actual exposure. All right, so what's the last step? Chromogen. And what's this going to do?
Change color.
All right, initially it should be what color?
Green.
Green. These are so good. 3?
3 drops into everyone.
All right, so in theory, first one I did was the positive control. So this should, in theory, should turn purple in about 5 minutes. 4, 5, and 6 should be on the negative control. That should stay clear. So I know I have visual, what's positive, what's negative. And now I'm going into the patient A. This is patient B. Should be patient C. And how many am I doing for each patient?
3.
Why?
Triple check.
Because if it was 1 or 2, you could get a false positive or a false negative. Okay, what's my last step? That should be it, right?
Wait.
Oh, I'm already getting colored. Oh, if anyone wants to take a look, I'll put the camera up there. That should be our positive. You bring that in here. All right, so,
Is positive.
well, this should be our positive right here.
Oh, that was our control.
Yeah, so that's our control. So that's what, this should be negative control. Now, is it me or does patient A look like it's turning slightly
Yes,
purple?
lavender.
Yep. And then I said either auto turn light blue. So patient B, or light green. So right now I don't know what's going on, but it looks to me like patient F might be a little bit on the purple side. And I'm not really sure about this patient yet. But,
You gotta give it a minute.
yep. But that looks positive. That looks positive. And one of these should be like a really faint purple. All right, so if it's faint purple, we have antigen-antibody reaction, but it's not going to be super strong, so the titers might not be as strong. So just start thinking about what could be a case scenario that would cause the titers not to be elevated as much. So probably it's an early infection. So today in lecture I talked about negative or naive B cells. Right, so they've never been exposed to the antigen. They haven't produced antibodies yet. All right, has anybody had a purified protein derivative test? TT, or what they call it, PPD? What are we checking for? We talked about today in lecture. Tuberculosis. So if you go in and if they do the test, when do you have to go back?
Within 72
So, right, so let's just say 2 or 3 days. And what are we checking for?
A bump.
A wheal or a bump, okay? So if you have a reaction in 2 to 3 days, that means you already have been exposed to it. That's your antibodies reacting right away. If you go back after 3 days and there's no reaction, what does that mean?
You've never been exposed.
Never been exposed, all right? So you don't have antibodies to it, or you could have been exposed you could expose recently. So just realize to get your titers all the way up, it usually takes anywhere from a week to 2 weeks. Right? Similar to this. All right, so I'm going to move this over. So it looks like our positive control is purple. Negative control is light green or clear. Patient A looks like it's purple to me. All right. Patient B, I don't see anything. Patient C, I don't see anything. D, I don't know. Is it me or is that really light purple?
I think it's really light purple.
Really light purple. I'm going to say this looks like there's nothing. E, F looks totally purple. So
He's nothing?
I see patient A purple. B, I don't see anything. C, I don't see anything. D looks really, really light purple. And it's in all three, so I know it's probably not a false positive. All right, E, I don't see anything. And F, I totally see a reaction.
When you say you don't see anything, is it green?
Yeah, come on over and take a look. Yep. I'll just use this. All right, so that's our positive right here. So that's giving us our positive. We know that that's antigen-antibody. We purposely, that is our indicator. Sorry. This is our negative, and we can say that's negative. All right, so this is patient A. Can everyone agree it's slightly purple? What about patient B? All three wells. I don't see any reaction. All right. What about patient C? I don't really see anything.
No.
All right. I'm not really sure, so I'm going to say this.
I don't know. I feel like I
It's
slightly
A,
see
B,
purple.
C. I say
I
that's
see a light
purple.
purple.
So I'm going to say patient D
Yeah.
has exposure, so I'm going to assume it's probably it's a recent exposure. They don't have full antibody titers. All right, E, I don't see anything. All right, but F, I definitely see. That's probably the strongest. That's actually even
Active
stronger than the positive control. So I'm going to say AD is light, E is nothing, and F. All right, I'm going to just stop the video for a second.